right. Good morning, everybody. Nikki Burnett here. Today's Taste Life Nutrition Radio and Podcast, streaming live on KUHSdenver.com, where we're always full of miscommunication but having tons of fun. Anyway, so today is heart health. One of my favorite topics, mostly because it's so deep and there's such a lack of true understanding around cardiovascular health, the markers to look at, what is the cause, right? What we hear in conventional medicine is it's all about cholesterol, which makes it very simplistic, and it's not a simplistic topic, but we need to have a deeper understanding of what to look for, how to understand our own bodies, and how to advocate for ourselves when it comes to our heart, our heart health. So, but first, as always, we start the show with gratitude. I've been reading a lot about, gratitude and biochemistry and how it can change us, and I really feel like I'm feeling like I want to do a show on this topic entirely. It's still a little truly hard for me to grasp because, we talk about us being energetic beings and how these thoughts can play such a huge role in who we are as humans, but also then can radiate out into the world. And I truly believe it's a fascinating thing that if we start to change our mindset and our thoughts and be intentional about it, that it plays such a big role in who we are and who we present ourselves to be to other people, which can start to just multiply these effects. So if you're grateful and positive at least as much as possible, right? Not everybody is this all the time, but that's the stuff that radiates, and it really radiates to others. And so it's always a goal of mine. It's always what I'm trying to do. I'm not always there, but that's also why I start the show with gratitude, because I want to sit here and I want to be thankful for, just having this place where I have the ability to speak what I see as truth, through research, through data, through good science. I have this platform to be able to communicate what the show started out as is truth, and it's really cool because a lot of people have this capability now. It's pretty amazing stuff, and so I'm grateful for that. I'm grateful for the fact that we're in spring, although tomorrow is going to feel like some winter again, but I've got little baby plants, my seeds are starting to sprout, and you've got the flowers, and this is just such a really beautiful time of year because it's new life, right? And I see it as new life, and it's just it just makes me really, really happy. So especially when it's really warm. So that's what I'm grateful for today, is just springtime, new life, and all the goodness that goes along with it. Getting out in the yard and having some fun, getting in some sun. The sun is such a gift. Oh, it's such a gift. So anyway, I do want to talk about the heart, and I want to talk about, I want to dig into lab markers, and I want to dig into genetics, and I want to dig into, one of my favorite doctors is Dr. Steven Sinatra, who's a cardiologist. So smart. He's where, I follow him. He's where I've learned a ton of what I know about functional nutrition and cardiovascular health at a deeper level than what we typically get in our labs. And I started reading a book, or listening to a book. I finished it, but I think I might listen to it again. But it's by Dr. Now I've just lost his name. Cowan. I had it pulled up, and it's Dr. Thomas Cowan. And it's all about the heart, but from from the perspective, more of a functional medicine, functional nutrition perspective, but also from a very spiritual, energetic perspective. And I really enjoyed it because it kind of brought the two together. You know, what we hear about cardiovascular disease to such a large degree is that it's solely based on cholesterol. So that's all we look at is cholesterol and cardiovascular disease instead of, a whole bunch of factors that go into it. It's all, biological, biochemical, it's, potentially genetic, right? So if we have our history of cardiovascular disease and or stroke in our family, then that's going to be what happens with us as well. And this whole looking at it is so simplistic, and it's not a simple process, and there are so many factors that go into it. And I think for us to truly understand our own bodies, doing these deeper lab tests, but then also going inside, right, and understanding who we are energetically, who we are biochemically, who we are biomechanically, who we are in our faith, who we are emotionally, because everything is connected and everything plays a role in our health or lack thereof. And so as I work with clients and patients on a day-to-day basis, although, my expertise is the biochemical, it's definitely not the mental and the emotional piece of it, but I always have to ask the question. I always have to, I do these really comprehensive intakes that take people a long time to fill out, especially if they have a long medical history. It takes a long time to fill this stuff out. But it's so intentional because I need to know all the details. And it's sadly fascinating the amount of people who struggle with trauma in their early years and how that can play such a role in who we are today. So I'm always asking, is this something that you've dealt with? Is this something that you are talking with someone about? And I think oftentimes we see that, yes, I've dealt with it and it's history and it's gone, but is it really truly, has it been dealt with? We have, these traumas and these stressors that sit in our tissues and create stress. More stress creates inflammation, and inflammation creates more stress, and then we start moving on down the line to disease. And so knowing that it is all connected and doing our best to manage as many of these factors as possible, which can be overwhelming. We need help with it very often. I know I do. But that's why I'm here also, is I want to be there to help. It's why I continue, my education and my research and my learning and follow the people like Sinatra and Thomas Cowan who have these amazing viewpoints, based in data when it comes to something like heart health. So one of the things, let's get to where sort of a good starting point here is, so the things that I think is really really worth understanding is, yes, cholesterol is a real thing. Cholesterol really does build up in the arteries, but the question is why. And so, and I want you to always ask that question, no matter what, right? Even if you think that you've gotten to the very end, there's always going to be another why, or there's always going to be more to it. I believe that that's the case, because even if we're looking at, okay, so cholesterol is building up. Why is it building up? Well, what we're told is either genetics makes it build up, or that's just sort of the way it goes, and it's not the case, right? If we are inflamed, it's going to create issues within the arterial wall where the cholesterol and then all the other factors come in and want to heal it, right? So what we need to kind of spin it in a positive way is the body's trying to protect us. Now, things can happen, but it's doing what it knows biologically to do to protect us, because in its essence, right, in its essence, the body, that's all it wants to do is to keep us alive. So when we have symptoms, those symptoms are the body talking to us, and that's kind of where we have sort of strayed, is we don't listen anymore. So we don't listen to this pain or this discomfort or this anxiety or this depression or whatever it is. We don't listen to it. We just cover it up with drugs. Happens a lot. Or we even cover it up with supplements, right? Or we cover it up with alcohol, or the list goes on and on and on. But what we need to remember is, if we take a step back and start to ask the question why, we'll start to dig in to understand what's going on in the body and why it's in this place where it's trying to protect us. So inflammation, I think this is something that is becoming kind of that basic. Now, it's obviously foundational, but we're starting to bring this word up more and more and more. Inflammation. Why are we inflamed? And in my mind, when I see inflammation, of course, we can have these big, I see it as either a big forest fire, right? So you got lots of inflammation and lots of disease and discomfort and dysfunction and all these things going on. Or we can have these tiny little grass fires that we don't really know is there. And it starts to grow and grow and grow, and that's when symptoms come up, and that's when the red flags in the body are coming out going, okay, I'm starting knocking on your door saying, hey, I need your help with this because I can't do this on my own. And that's when we start to see, people starting to spiral. And I see this so often where you've got, when I look at people's history with them, and they say, okay, so I had, I had constipation as a kid, and you can watch as they have spiraled throughout their, 10 or 20 years or 30 years or whatever it's been, because whatever it was here was never addressed. So can that lead to cardiovascular disease? Sure. So if we look at it epigenetically, so epigenetics is how our body expresses, right? And so epigenetics is how our genes express. It controls how our genes express. And so, yes, we can have cardiovascular disease, stroke, all of those things, in our history. But epigenetically, we can have that potential, right? We can see it so often. We can see that there's the potential, but it doesn't mean that that's what we have to deal with, because it's our choice, the decisions that we make every day. So I think where a lot of this can come in too is, there's accountability in the choices that we make, but it's super helpful when we can look at lab tests as well as our own genetics, to understand our potential, to understand what's going on. So then we have the ability to make these choices, based on information, based on data that impact our lives. And so does that mean then that we have the capability of decreasing our risk for these really terrible outcomes? Absolutely, which is the most amazing thing, and which is why when I'm doing testing, I'm going as deep as I can, because I may have somebody coming to me for GI dysfunction, but I want to understand what's going on with all of these other markers as well, because they all play a role and everything's connected. And when there's inflammation and there's genetic markers, then, and lifestyle choices that may not be optimal, then that's going to lead us down a path that we don't want to go. So we can take all of this information early on and then make the choices to help mitigate what our potential is, right? Negative potential anyway, and bring out the positive potential. So a couple of things that I want to make sure that, as far as the basics go. So cholesterol, what we see in our, typical, sort of comprehensive metabolic panel, we've got our HDL, LDL, sometimes there's VLDL, sometimes you'll have total cholesterol, and then the ratio, right? And triglycerides. So these are pretty basics, but they don't give us the whole story. When I'm looking at this, what my question is going to be, so if I see an LDL that is too low, I'm thinking, is there an immune issue going on? If I see an HDL, which we're told we want HDL to be as high as possible, that's just, it's incorrect, because if I'm seeing HDL pushing 80 or higher, I've seen it up into the hundreds, then I'm thinking there's an autoimmune situation potentially that's going on, and we need to dig deeper. So it's not about these numbers being just, something like HDL being as high as possible or LDL being as low as possible. We need to understand the details of HDL and LDL. So we want to look at the particle sizes. So LDL is broken down into particle sizes, and there are a number of them, but the two that we test most often when we're digging into these particle sizes are SD-LDL, which is small dense LDL, and then there's oxLDL, which is oxidized LDL. So I may see LDL is elevated. What my next question is going to be, as I'm looking at a panel that I would run, or anybody in the functional medicine, functional nutrition world, is I'm going to say, okay, so this LDL is elevated. Sorry, back up real quick. LDL brings cholesterol to the tissues. LDL is just a protein, right? It's a carrier protein. It brings cholesterol to the tissues. HDL takes cholesterol away from the tissues to either be eliminated or recycled. So this is key in understanding the importance of LDL. We have demonized it so tragically, and we're thinking we've got to have it as low as possible. And this is such a again, it's a terrible way of looking at something that is normal and natural to the body. We have to have cholesterol coming into the tissue. We have to have it for brain function, for cellular health, for hormone production. We have to have cholesterol. And so to say we need it as low as possible is, again, it's tragic. It's not correct. So we do, though, need to have a higher amount of HDL, because we want to have those LDLs that have been oxidized or that may no longer be providing the function that it needs to provide. It's got to be eliminated. So yes, HDL has a big role in eliminating LDL that needs to be eliminated. But we got to remember the importance of both of them. They're very, very important. So when we break down LDL, we're breaking it down into oxidized or small dense, because when we look at what is normal, it's big fluffy particles, right? So I just see them as these big fluffy particles that will, sort of run around the body doing their job. But in a state of inflammation, in a state of high stress, in a state of really, terrible food choices, all of these things that we deal with in life, what's going to happen is it's going to increase the inflammatory response in the body, which then creates these particle sizes that are small, dense, and oxidized. And so that gives them what happens then when that happens, they are angry, right? That's essentially what it is. They're angry, and they have the ability then when the protein zonulin goes up and pulls cells of the epithelium and the endothelium apart in the GI and the cardiovascular system and in the brain, blood-brain barrier, these cells come apart, giving the opportunity for these cholesterol particles, these small, dense, oxidized, angry cholesterol particles to jump into the wall of the cardiovascular system of the arteries, right? And so this is when things start to build up, because when that happens, it's a trigger. It's a big red flag going, okay, we have say like a cut, right? So you can think about it as a cut. And when you have a cut, you have this cascade of potentially inflammatory molecules that come to cover that and to scab it over. So it's protecting us. And so it's doing its job, but it's just doing its job as and potentially creating a problem if we're not addressing all of the things that are so important in this cascade. So lowering inflammation, right? That's going to lower the opportunity for these cells to come apart, lowering the opportunity for even the presentation of small, denser oxidized particles. but they're not going to have the capability of getting into the lining of the artery because there's no cut there in the first place, right? So it's a little bit simplistic, but that's how I see it in my head. So we want to make sure that especially when we have a history of cardiovascular disease, but I think for anyone, that we're running the labs that are these deeper, that gives us a deeper understanding. So looking at the LDL, the small dense LDL, but there's another marker. And this is a marker that can be really difficult. And I think it's so important that we all have it run because it's more of a hereditary or genetic marker, and it can be much more difficult to manage, but it can be managed. I've seen it come down, but it is more difficult to manage. It also, though, is what oftentimes will be seen as the marker that can be that instant, okay, you have a heart attack and you're done, right? It's that widowmaker kind of heart attack. And so this marker is called LP little a. And so it's lipoprotein with a parentheses and a little a, right? And so that's one that, in my mind, every person needs to know where they stand with this LP little a. And then if they see it elevated, I see it elevated regularly. Younger people, older people, it doesn't matter, across the board. I see it elevated. And so knowing that marker gives you the ability then to keep track of it, know where that number is, and know that you have the ability you do have the ability to bring it down. It's just not easy, right? There are some markers that come down super fast and super easy, just by a change of lifestyle or some supplements, that kind of thing. But this is not one of them. It is more difficult, but I've watched it come down. So knowing that LP little a is really, really important. And then moving on, ApoB. So we have ApoA1 and ApoB. And so both of those are more closely related to dietary factors, right? So ApoA1 is good. We want it in, it's a good one to have in good normal range. It's a positive. Whereas ApoB is more of a lifestyle negative, sort of an inflammatory marker. And so what it says here is an accurate picture of atherogenic particle burden. It's a more accurate picture of atherogenic particle burden than total LDL. So keep that in mind when we're not testing in conventional, our typical CMP, comprehensive metabolic panel, and we're not looking at ApoB, we're not getting the whole picture. But also that's that picture of, okay, what am I doing in my diet that is that's elevating this ApoB, right? And so we can think about that pretty easily, which is great. These things, when we know them, we can make the change and then make big change, biochemically. It's awesome stuff, right? So going back to inflammation, there are some markers. There's CRP, which probably most people have heard of. I just talked about the LP little a. There's MPO, and those are more of the systemic inflammation. So CRP, I see CRP run mostly by a cardiologist. Rarely do I see it run by a general practitioner. But it's a marker that I'll run every time I can. If somebody comes to me and they have the CRP, I'm like, hallelujah, I don't have to run that. But we need to understand our inflammatory, the inflammatory process is going in the body. And there are multiple markers for this, but CRP is more of a systemic cardiovascular marker, but can be elevated even if we don't have cardiovascular disease necessarily. But we want to make sure when we're looking at inflammatory markers, if we start to see that they're creeping up, and CRP is one that I want to see it as close to 0 as possible, right? The range is like 0 to 3. And some will say, if it's sitting at 7 or 8, not that big a deal, you got some inflammation. But you got to think, really, if you're sitting at a CRP over 3, it's that little grass fire. It's just sitting there pissing the body off. The body's trying to fight it. It's trying to put it out. It can't figure out what's going on. And that's where we got to jump in and say, okay, there's something that is triggering an angry response, and we don't want it to move on down the line where it's going to push whatever we have the potential for, right? Could be heart attack, stroke, autoimmune disease, you name it. So addressing the inflammation, knowing that it's there and addressing the inflammation, that's going to be the other thing that I look at if I'm looking at just LDL, and I don't see, if I'm looking at LDL and I also see CRP, then I have to know if that CRP, the inflammatory marker, is pushing oxidized LDL and small dense LDL, right? So you're starting to see how we can put these pieces of the puzzle together to have a better understanding of what's going on inside. And so I think the other thing really to make sure that we talk briefly about is the markers. There are general lab markers, and then there are the functional ranges. So there are the general lab ranges, and then there are the functional ranges. The general lab ranges tend to be a little broader, whereas the functional ranges tend to be a little more narrow. And so when I say that, what happens when we're looking at markers functionally is we're going to have more red flags come up, but that's how we see them. Functional ranges are more optimal ranges, whereas lab ranges are based on, sort of the broad sick population. We don't want to be compared to that, right? We want to be optimal. And so functional ranges are more optimal. More red flags are going to come up, but when we have more red flags, doesn't mean it's pathogenic necessarily, but it means that we have more pieces of the puzzle that we can start to lay in and have a better, deeper understanding of what's going on inside. So MPO is an interesting one, and I see it elevated pretty regularly, which it indicates an active inflammatory response within the arterial walls. So we can see it can be in yellow and it can be in red, but if I see it in yellow, why is there an active inflammatory response inside the arterial walls? What's going on and what's pushing that, right? So it's an important one to know. Another one that is tested more often, but not as often as it should be, is homocysteine. That's a really big deal because not only is it a cardiovascular risk factor, but it's a cognitive risk factor. And the ranges are sadly wrong. I mean, so you look at, I think that the general lab ranges for homocysteine, I think it's up to 13, maybe 14, whereas what the data is showing for cognitive health, anything over 11 is 100% chance of cognitive decline. So I want to see homocysteine like at 7. Is it just a little higher or just a little lower? I also don't want to see it too low. That's a huge problem as well. But seeing it right around 7 is perfection. As it starts to creep up, then we start to wonder why and what's going on. A lot of times it's nutrient deficiencies. It's things like B12 and folate, magnesium, trimethylglycine. You'll see these supplement support protocols that might be specifically for homocysteine or for methylation, because it has this combination of ingredients in it. Now, a lot of them will only have these B's in it. So often we're missing something if we're not including the trimethylglycine. And an example of that is my husband. Back a couple of years ago, his homocysteine was sitting up at 18. I was like, what is going on here? So we've been loading him with B vitamins. Sometimes that's sufficient. But now we just did his testing and he's still at 12. So what's pushing the inflammation? Is there oxidative stress? Oxidative stress will also push homocysteine. But oftentimes what might be missing out of some of these supplements that are in combination, as great as they are, if they're missing something like trimethylglycine, that might be the missing piece there. So that's not what I've been, am I lying? I don't think that the supplements that he's been taking has the trimethylglycine. So although it's come down, it's not come down enough. So again, going back to it though, we have the information now. We have the information to know where we start to pivot so we can continue to help to bring that homocysteine down and any of the other markers, right? So we did a full panel on him, the comprehensive metabolic panel, as well as a full cardiac health panel. And so, this is the stuff that is the amazing preventive way of optimizing our health. It's just beautiful, it really is. So, making sure homocysteine is in line because it damages the endothelial lining, and a lot of times is due to nutrient deficiencies, which is easy to manage if you're low in B12 or folate. We know how to manage that. So, but we want to, if you have come back and your methylation or your homocysteine is elevated, always make sure you're testing that marker. Don't assume that you get it back in line and it's just going to stay there, right? You always want to test it, whether it's every 3 months while you're starting to manage it, every 6 months, or moving into maintenance every year. Know what that number is. I think that's important. Same with vitamin D. You always want to test it and know what that number is. And it helps you to know, again, it guides you, but it helps you to know, dosing and all kinds of stuff. So, okay. So, the other thing with triglycerides, triglycerides is a great marker. You'll see it on a general, comprehensive metabolic panel, but it's directly related to diet. If your triglycerides are high, your diet's not great. So it's pretty simple and straight to the point. But we want to make sure that that's something that is addressed, because we don't want triglycerides to be high. If we're looking at triglycerides high, then we look at, the potential for, glucose being high and insulin being high, and we're looking, are we pushing, metabolic issues? So these are all important. Right now I'm kind of focused mostly on heart health, but if your glucose is elevated, that's going to make everything sticky. Literally, it makes the blood sticky, it makes the organs sticky. It's just sticky because it's sugar. And then, if you become insulin resistant and your insulin's too high, right, it's this whole metabolic cascade that is a part of cardiovascular health, but then it starts to lead into cognitive health and kidney health, and, the list just goes on and on. So, the comprehensive metabolic panel is an amazing tool, but for me, I just add to it. There's more that I need to know in order to understand as much about the story as I can. Okay. I think the other one to make sure that we're looking at, which goes back to stress and inflammation, is just cortisol. We see cortisol elevated all the time. We have, it's supposed to go with our, diurnal, it's a hard word, rhythm, right? So cortisol is low, it's low at night, and it elevates, and then it goes down because it's while you're awake, right? So your blood sugar spikes, which, wow, my brain farted. So yes, your blood sugar spikes, which is going to push cortisol, which is going to wake you up, right? And so that's why it is elevated, and then throughout the day and at night it goes down. So, but if we have chronically elevated cortisol, if it spikes and it stays spiked, so it's chronically elevated, so then it becomes catabolic, so it's breaking down tissue, breaks down muscle tissue, we can put on weight, and it's inflammatory. So that inflammatory process is just going to continue to push, right? So think about what's going on in your life. Think about, the mental and emotional stuff, the financial, the relational, all of those things, the work life. All of those things will push inflammation if you're chronically stressed. But if you also have a condition that you're struggling with, right? So the physical conditions that's going to push inflammation is going to push stress, push cortisol. And again, it goes back to, it's that downward spiral. So what is it that we can do to manage that, right? So we've got to get outside. We've got to get in the sun. We've got to pray. If you're a prayer, please pray. If you're not a prayer, please pray. But we've got to pray. Meditate, walk in the grass, calm the body, calm the sympathetic to the parasympathetic, which leads me into Dr. Thomas Cowan. So he says all of these things, same things as far as the biochemistry goes, but it's super cool the way he looks at the heart. He's one of those guys that questions everything, and that's what he talks about in this book. He's questioning everything when it comes to what we're told about the heart. including, is the heart actually a pump? Fascinating stuff. And so I only listened to the book once, so I'm not going to dig into his philosophy of the heart, that it's not a pump. But listen to the book if it's something that interests you, because so much of it is based around the sympathetic versus the parasympathetic and the vagal nerve. So we have our sympathetic nervous system, which is the drive, the go, the cortisol being elevated, the stress, the running, it's that go, 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 where then we have the parasympathetic, which is the rest, the digest, right? So if we're in sympathetic, we don't rest and we don't digest. So keep that in mind. But if we're in the parasympathetic, things are calm, the body's calm. This is where we're intended to be most of the time, is in the parasympathetic. This is when we have the ability to think and to create and digest our food. All of these things that are parasympathetic. Also, though, when it comes to the vagus nerve, so the vagus nerve is what connects our brain and our gut, but it also connects to our lungs, it connects to our heart. So if we are sitting in sympathetic, the vagus nerve is impacted, which means often what can happen is then vagal tone is decreased, and so it decreases everything that it touches, right? So it's decreasing heart function, decreasing lung function, decreasing GI motility. So if you're constipated, things don't move well, is that potentially vagal tone? Sure, it can be. There are other things as well. But the way that Dr. Cowan views the heart, let me get to my notes on him because it's pretty fascinating stuff. So he proposes that the heart modulates flow, but the blood's movement is driven by its own energetic and structural properties. So this gets into structured water, which I'm not going to get into. I only know a little bit about it, but if you're interested, look into structured water. There's a supplement that I take and that I'll give to those that looks just like water, but it's actually structured water, which is what the body needs, is this structured water. So he also says when it comes to coherence and rhythm and spiritual health, the heart synchronizes with emotional, neurological, and spiritual rhythms. Trauma, grief, and loss create energetic blockages that manifest physically. And the heart as an organ of connection, resonance, and flow. Super cool stuff, right? So we what we look at is the heart just being this muscle that's pumping. Again, so often if there's something that we don't understand, then we make it very simple, right? The heart, it's a pump, it's doing its job, it's pumping the blood. The same, we have our lymphatic system. Our movement is what pushes and pumps the lymphatic system. So it'd be interesting to dig in deeper into that. What more can we learn about what the lymphatic system, besides just, a drainage pathway? What else, how else does it move? What is it that's potentiating that movement? So as far as the heart's concerned, the heart pumps because of the blood, because of the rhythm, because of the vagus nerve and our sympathetic versus parasympathetic system, right? So much of this stuff is involved, which takes us to then, if we're struggling with this trauma from our history or a current trauma, or the stressors, the mental and emotional stressors, or if we're lacking true spiritual connection, how is that going to impact the heart? I'm going to say this knowing that I don't know the stats behind it, but I believe what he said in his book was that a large majority, if not all, of those who suffered from a heart attack had markers for high stress, high sympathetic nervous system. So going back to the many things that we have the capability of doing to mitigate our negative potential is literally taking the time, like I said, to go outside, to walk in the grass, to dig in the dirt. This, again, going back to my favorite time of year. This is what I'm doing, is digging in my garden. I'm digging in the dirt. My husband's like, you want some gloves? No. not unless I need them, right? But I want to dig in the dirt. You know, if my fingernails get dirty, who cares, right? It is that meditative, you know, place of enjoying the energy from the earth and what it gives to us. And then knowing that what I'm doing is creating these little lives, right? I got these little plants that are coming up. It just makes me super happy. And I go out every day going, where are they? And they're finally starting to come up. So it's this beautiful thing about life, right? But it's this energy behind it. So we can't just look at the body as purely mechanical or purely biomechanical or biochemical when we have this energy. You know, everything about us is energy. Everything that we are is energy. And so keeping, you know, taking that to heart, I think is it's helpful in management, right? To be repetitive. So I wanted to make sure that I hit on that because I think that it's it just makes a world of difference when we understand all of the different layers that come into our health. So I want to move into, let's see, we talked about all that. Let's move into a little bit about genetics, because we have the ability to look at our genetic potential for detoxification, our genetic potential for different types of toxins, whether they're heavy metals, whether they're mycotoxins, whether they are pesticides and herbicides. We can see if our potential is not to eliminate those well, or if we do eliminate those well. So we also have the ability to look at our genetics that that create our potential toward cardiovascular disease or health. And so when we know that, we know how to start to mitigate it. We know how to manage it. We know how to eat, and maybe the supplements to take, right? So, you know, I'm not all about supplements, although I guess to a degree I am, because sometimes it can be really hard to get in all the things that we need, especially when our food is so depleted. Very often it's very depleted. So therapeutic supplementation can be a game changer. You know, you go back to when we were talking about, you know, the stem cell company, StemRegen. You know, they have a heart failure study. You don't have a lot of supplements with studies like that. They have a Parkinson's study. You know, when we, you know, it's really difficult for us to eat specific types of algae all the time that are going to push our own stem cells. But if we take this supplement that is super targeted, super focused, super concentrated, and allows us to then release our own natural stem cells, I mean, that can be a game changer for those with heart failure, or with maybe early onset Parkinson's or Alzheimer's or any other condition that we're struggling with, right? So these are the things that are just fascinating, that we have the ability to, whether it's to supplement or to eat or just to have the knowledge about, so we know we can start to search on what it is that we need to do. So, you know, we were talking about homocysteine and methylation. So these are part of detox pathways. And what's interesting is when some of these pathways don't work as well as they should, or epigenetically, the enzymes may be a little dysfunctional, or we don't utilize our folate the way that we should. One of a good friend of mine, you know, we've had him on, Dr. Ben Bush. You know, one of the things that he tells people is, like, nobody is a mistake, right? The way we're made is not a mistake, but we are made differently. And so when we know that this area of our biology is maybe lacking a bit, we just know how to manage it, how to fix it, right? So let's take some B12, let's take some folate. So sometimes it's that simple and sometimes it's not. But methylation and the detox pathways are super important, obviously, because we have to be able to detoxify. And so we can have the gene, this is the one that most people have heard of, which is MTHFR. And I think it's important to remember that this is just one. You know, people will go like, I have the MTHFR and it's the end of the world, and it's just not the case. It's how you're made. It's not a big deal. You just manage it. But it can be impactful in detoxification and in fertility. So again, when you know it, that's power. Knowledge is power. And so impaired folate conversion can increase homocysteine, which then can increase arterial damage, right? Then there's the COMT gene, or the COMT, poor clearance of stress hormones, and heightened sympathetic tone. So going back to, that's the sympathetic nervous system. If you have elevated sympathetic tone, then it's cortisol, it's stress, it's inflammation, right? We have these CYP enzymes affect liver detox, oxidative stress, and lipid metabolism. So knowing that you have those, then we have lipid transport and endothelial function, so ApoE. ApoE is an interesting one because there are 6 subcategories of ApoE, and you have, and each of them means something different. But ApoE is also so there's APO, let's see, it's 2,2, 2,3, 3,3, 3,4, and 4,4. You start getting up into 3,4 and 4,4, then you're looking at the potential for Alzheimer's. And so it's one of the ApoE4 marker is one of the best indicators of Alzheimer's, especially if you're a 4,4, which is me. So I know this about myself. That means, and it's not in my family, interesting, nobody's been diagnosed with it anyway, thankfully. But knowing that I have that potential, and it's like 90% chance, right? I mean, like, it's a pretty big potential. But if I know it, that gives me the power to know how to mitigate it to the best of my ability, right? It's an epigenetic potential, which means I don't have to have it. Also means if you don't have this marker, if you don't treat your body well, you can still get it, right? They also call it type 3 diabetes, Alzheimer's. And so if we're not managing our glucose levels in our diet and our lifestyle and our stress and our inflammation, it can push, because stress and inflammation can increase glucose levels. And so it can push Alzheimer's as well. So, again, it's just amazing. Knowledge is power. It's so beautiful. There's one here that regulates HDL particle functionality, not just levels. There's the NOS3, which impacts nitric oxide. So nitric oxide is essential for vasodilation, as well as endothelial repair. One of the great things is we have these cool supplements that can be really important for producing nitric oxide if you're not producing your own. So knowing that you have the potential to not be able to produce the nitric oxide the way that you should, then you just supplement it, right? And it's pretty simple, which is great. So a couple of these other ones, I don't want to get too deep into it, but we have these markers, as it says here, kind of the key takeaway is, genetics reveal vulnerability, but epigenetics tells the story we actually live out. I love that so much. And we can modulate these pathways with targeted nutrition, detox, and lifestyle. So it's all complicated stuff, but we can kind of take it down to these basics and manage, what we see in these pathways. So let's see what else we want to talk about. So we already talked about all of those. Let's talk about some supplementation. Well, I say supplementation in food. Most of these supplements do come from, originally come from food, but a lot of times if there's need, we may want to supplement therapeutically. I mean, I do that all the time. Specifically CoQ10. CoQ10 is amazing mitochondrial support. If you don't remember what the mitochondria is from, whatever, 7th grade science class, we have mitochondria in all of our cells. So they produce energy. They help us, they give us energy. So if we're fatigued, we're struggling with mitochondrial dysfunction. If we have any kind of condition or issue or symptom or disease, right, there's mitochondrial dysfunction that goes along with that. Each cell has a different number of mitochondria. Some have a few, some have tons. So that would include our heart and our brain. They're always moving, right? They're always producing, they have to have a ton of energy in order to work properly. So CoQ10 is super important for cognitive health, for all mitochondria, for heart health. And I want to briefly get into statins, which I think are a huge problem, and most people in functional medicine, functional nutrition agree with that, except in specific, very few cases where there has, so I'll say it, statins may have a role when you're a man who has already had a cardiovascular event. So pretty simple and pretty straightforward. And there are a lot of those people, right? But if you've not had an event, and if you're a woman, because it has such an impact on brain function and brain health, one of the comments in Dr. Sinatra's book is that it makes women stupid. So that's not good, especially we're already, so many of us struggling through, the perimenopause and the menopause and the hormonal, fluctuations, and which impact our cognitive health, right? So we don't need another layer of cognitive impact, right? We need to support this stuff. So, CoQ10, really important, but there are a lot of great things that are super important mitochondrial supportive nutrients. L-carnitine. L-carnitine is a conditionally essential amino acid. So our bodies may make it, but if they doesn't make it, then we get it from meat, and we only get it from meat. So if we're not meat eaters, where are we getting our carnitine, especially if we're not producing it ourselves, right? So L-carnitine is super important. It's the only amino acid that actually puts fat into the cell to be used by the mitochondria to produce energy. So it's a great one. There's also D-ribose is a really great one. Magnesium. I mean, if we're deficient in anything, so often it's magnesium. So there are all of these different forms of magnesium. And so I'm in this place now, I think I'm taking 5 different forms of magnesium because they all do different things. So, we have a lot of companies who are creating, triple mag. So these different forms that are all in one, which is great. So I have 1 triple mag and then 2 different other types of magnesium. And it's just sort of part of it. But we want to make sure that that's not something that we're deficient in. Other cool things, methylene blue. Probably, they're calling it a peptide. Is it truly peptide? I don't know. I've just started taking it. But you're starting to hear more and more and more about methylene blue. Super safe, but what's really important, you can get it, we get it from a compounding pharmacy, but you can get it online, but you don't know the quality, you don't know how good it is, and be sure that you know this. There's a test called G6PD deficiency. It's really, you need to have that tested before starting methylene blue. I think it's really important. Now, does it come up a lot? Not to my knowledge. That my understanding is it doesn't come up very often. But if it does come up, could it be problematic? Yes. So G6PD deficiency testing for taking methylene blue. But methylene blue is it's not a natural substance, but it was discovered, I think, in the 1800s. I thought I heard the 1700s, but I think it was the 1800s. You will see it. It's an industrial chemical dye, that kind of thing. But the purified form of it is this amazing mitochondrial support. Lots of research on it, or more and more research coming up with, cognitive health and cardiovascular health, neurodegenerative diseases, that kind of thing. So methylene blue is really cool stuff. Started low and slow, but I think it's one of those really great things that's coming to the forefront, as long as it's pure and clean. You got to be really careful with that. So many things that we don't know that we're getting online can be high in heavy metals, or it doesn't work at all, and it's just creating more problem than it is good, right? So be really, really careful with that. Let's see, what else do I want to run into? So we talked about Dr. Thompson. I think that we're kind of at our end, which is great. I think I want to hit on a little bit, though, the importance of faith when it comes to heart health, and how so often, what we often see is, if we don't have faith, we don't have a foundation. And if we don't have a foundation, then we're just grasping, right? And we're grasping, and things become hard and confusing, and there's lack of clarity, which is going to push stress, which is going to push inflammation, which is going to push, dysfunction and disease, right? There are some really amazing books out there that are connecting all of these things, and I find it fascinating. I just started one called The Anatomy of the Spirit. I think that's what it is, The Anatomy of the Spirit. So I'm like within the first chapter of it. But it's really cool because it's connecting everything, because everything is connected. And I think that, you know, if you are finding yourself in a place where you're struggling, grasping, and not sure about things, then, you know, find these books like The Anatomy of the Spirit that can help you to understand. And of course, you know, I'm a Christian, so I fully believe that this is the way to be. This is the way to go. This is the way God created us. This is why He sent Christ. You know, we're in the Holy Week right now. It's so beautiful how all of this has come together, and how we are guided by God, guided by Christ in all of this and what Christ did for us. But we have to have a good foundation so we're not scattered, because I fully believe that it has if there's a hole there, it's going to be filled with evil. And so we see a lot of this going on right now. And so find your foundation and find your connection. So not only is it going to help spiritually, but it's going to help the physical. It's going to help the mental and emotional, right? It's just how we're created, right? And so, so I guess the last thing here just says, you know, all of this together cultivates true cardiovascular resilience from the inside out. And I truly believe that. I think we have to continue to ask the question why. We have to continue to dig deeper into our understanding of our own body on all of the many levels, and sometimes we need help with that. I need help with that. I have my guides, my people who help me to understand myself at a deeper level. But that's what life is. Life is about the search. It's about being curious. It's about learning to understand what I can do on the inside, and then how I can help on the outside, and how I can serve on the outside, and how I can give. So anyway, I'll kind of get off my soapbox here, but I hope my takeaway is to not stop asking why. Really dig into and understand your labs, and know that when you go to, very often, most of the time, when you're getting just a general comprehensive metabolic panel run, that's what it is. It's pretty general. The lab values are very general. They're not optimal. And so you want to ask the questions and know what you need to do to dig in and dig deeper. You know what, actually, I should have had it put together for this. I'm putting together essentially it's a booklet. It's just not finished yet, but it's a booklet on lab values, on functional lab values and the meanings behind them, and how you can take this and take your labs, know how to ask the questions and ask more questions, and understand the lab values that can be beneficial for you and that are optimal lab values. So sometimes there's too much going on. I should have had that for this show, but I will have that, and I'll have it posted. If you have a question about it, feel free to reach out. I'm happy to have that for you, and we'll send it out. But I think that this is, you know, having resources like this is a way that we can, again, we continue to learn more about ourselves and what our bodies need. And we know these numbers. To me, this is our body. This is these labs, these deep labs, our body talking to us on a deep level. And this is just how we get better. Cool. All right. So, as always, we're here Thursday, 10 a.m. Mountain Time, streaming live on KUHSdenver.com. You can find me at tastelifenutrition.com, Taste Life Nutrition on all of the socials, all of the places. You can go to the website. I have a free assessment you can fill out. It really is, it's pretty quick. It's probably like 5 minutes, but it's really goes through all of the organ systems, the mental and the emotional health, all of these things. Gives me a little bit of a background on what could be going on with you, and if I might be able to help and to support and give some guidance, or if there's somebody I know better who might be a better option for you. So fill that out, reach out to me, let me know if there's anything that I can do to be of service to you. I'm here. You know, you can reach out on Facebook, or, I mean, you got my number on my website. Call me. So anyway, Tanya, thanks so much for hanging out. I hope you all have a wonderful, wonderful week and weekend, and we'll see you next week. This is going to be super cool. So I usually am booked out for months and months, but I was just going to come on again myself next week. We're going to have a chiropractor, actually probably 2 chiropractors, a couple on. One of them does dog chiropractic. I was like, okay, we need to have you on the show. So we're going to have Danielle, who does dogs and horses. She also does humans. And then her husband, who does a lot of the neurological chiropractic, kids, ADD, ADHD, that kind of thing. But that's going to be really fun. If you know me at all, you know that I am a dog horse person. At this point, I don't have horses, but I have lots of dogs. I feed them raw, and so we'll dig into that. We'll dig into the importance of raw feeding and chiropractic for dogs. I'm going to call her, have her come and adjust my girls. So anyway, next week, that's going to be a really fun show. We'll see y'all then. Bye. Thank you.